Hello, everyone. Welcome to MRCEM OSCE Preparation series. And on today's video, we'll have an overview of the MRCEM OSCE exam. I'll give you some top tips to pass the exam, and then we'll discuss about what's the general template for most of the stations. For those of you who have not seen our previous videos, my name is Dr. Apoorva Chandra, and one of the consultants in emergency medicine. Without further delay, let's move on. Now, coming to the exam. So as some of you might already be aware, so the exam consists of 16 stations. Each station lasts for about 8 minutes, and you'll get 1 minute of reading time to read the instructions and look at the pie chart before you start the station. There will also be 2 rest stations of about 8 minutes. Now, the scoring system or the marking system of the exam is called domain-based marking system. And things will be tested on in most of the stations are clinical reasoning and decision-making, your communication skills, including conflict resolution, history-taking skills, clinical examination skills, your practical skills or procedural skills, teaching skills, and organizational skills, right? Now, who can take the exam? So you need to clear your primary or an MRCEM intermediate or the SBA, and you should have at least 24 months or 2 years of experience post your qualification. And out of those 24 months, 6 months should be in emergency medicine. This page shows the general structure of the exam. You can have a look at the 16 stations and how they're categorized and what usually are the stations as well. So for example, there are like 3 stations which says complex stable patient, and there are 2 resus stations. There is a pediatric station, and there are some procedural stations as well. And then there are some teaching stations. So I'm not going to go into the details of each type of stations now. I'll provide the link on the description box below, and then you can have a look at the RCEM website for further details on this. Now, coming to the top tips. Tip number 1, the most important tip I would say is practice, practice, and practice. So unlike your MRCEM SBA or the primary exam, where reading would have been more important, for OSCE exam, practice is extremely important. The more you practice, the higher the chances that you'll pass the exam. Another very useful tip would be to find someone in your workplace who can give you some feedback when you present to them or when you practice, right? So what you can do is, if you can speak to a consultant, present to them 1 station every day or once in few days, and then if they can give you some feedback, that'll be excellent. This is extremely helpful. Form a study group or find a study buddy, right? There are a couple of advantages of doing this. 1, when you have a buddy, you can motivate each other, and then you don't lose interest or don't lose focus when you do that. The other important thing when you do this is that you can give feedback to each other. That will really, really help in preparing for the exam. And you can also discuss few things. If you need to revise something, if you need to study something when you practice, then you can do that together as well. So it speeds up things. Another tip, we are going to discuss this multiple times when we discuss specific stations, but have a perfect opening line and have a perfect introduction for every station. Another tip, you probably might already be aware of this because you're watching this video, so you kind of have a friend already. So internet is already your friend. So, but there are also some other websites and other YouTube channels which you can make use of. A lot of people ask, are there any specific books that they can make use of? So I don't think there are a lot of books for MRCEM OSCE, but this is one of the books I found very useful when I was preparing for the exam. This is an old book, so this was kind of formulated on the basis of checklist-based marking system and not on domain-based marking system. But I think since the stations are somewhat similar still, you can still make use of this book. Now, whenever you look at the stations, so sometimes you may feel that, oh, I still don't know what the diagnosis is, or I'm not really sure what the station is about. But still, you can pass the exam because reaching to a specific diagnosis is not always important. But if you are very logical, structured, empathetic in your approach, you'll still pass the exam and you'll still score very well. The most important thing I would say is reading the pie chart. So what does that mean? So whenever you are outside the hall or outside the room before you start the station, so there will be some instructions, and then there will be a pie chart. So on the pie chart, it'll tell you what area to focus on. So it'll tell you how much the history would be scored, how much the examination is stressed on, and how much the communication part is stressed on. So for example, if you look at the pie chart, if you don't concentrate on the pie chart, if you take a very good history, you elicit every kind of history, but the pie chart has only about 10% weightage on the history taking, and it focuses more on your communication skills and your examination, you'll fail the exam despite taking a very good history. So it is extremely important that you analyze the pie chart before going into any station. In most of the exams, you will find there are some tricky stations or some difficult stations. So this can happen in two ways. So one, you look at the instructions and then you suddenly realize, oh, I don't really know what's going on here. I don't know how to do this station, right? It is still okay. So remember, go in, do your basics right. Make sure that you are following a structured approach and be empathetic, and then summarize everything very well. There is a high chance, despite the station being very difficult, you'll still pass the station, because if it's a really difficult station, it'll be difficult for everyone, right? So you probably might still pass the station if you do everything in a structured manner. The other scenario would be when you look at the station in the beginning, you might feel that it's going to be okay. Once you finish the station, once you come out, you have this feeling that, oh, this station didn't really go well. But if that happens, forget about that station. Don't stress too much about it, right? So if you stress too much about one particular station, all your next station, all your rest of your other stations will go bad as well. So don't stress too much on one particular station, just forget about it, and then have a fresh approach to your next station. The last tip would be about courses. A lot of people ask, is there any use of attending courses for MRCEM OSCE exams? Yes, there is. Two main reasons I can think of is once you're attending a course, they do a lot of practice sessions as well. And if you're attending a practice session, you get a lot of individualized feedback, which will be really helpful in preparing for the exam. And many of these courses also conduct mock exams before the actual exams. And attending mock exams is really, really helpful. So some of the famous courses or some of the well-known courses I can think of are Bromley emergency medicine courses, Study Medic emergency medicine courses. I'm not saying that you'll have to attend only these courses, but these are the well-known ones. There are a lot of other courses. Many might be really good as well. You can speak to the people who have attended some of these courses and see which one you want to attend. A lot of them conduct online courses. Some of them are online, and some of them are partly online and partly offline, and some of them are completely offline as well. Depends on what you want to do. So you can choose any of these courses. Now that we've talked about the top tips for the exam, let's talk about the general template for majority of the stations. There might be slight difference in one or two stations, something like a resuscitation station, a teaching station. The general template might be slightly different, which we'll discuss individually when we talk about those stations. But generally, if it's a patient-facing station, the template would be same. Now, you always start with the introduction. You can start by saying your name, what your level or grade in the department is. So you can start by saying, my name is Apoorva Chandra. I'm one of the registrars in the department. And then confirm patient's name and identity. So you ask for the name as well as the date of birth. Next, sanitize your hands, wear appropriate PPE, or at least verbalize this, and always ask for a chaperone. Definitely yes for all the examination stations, but it's always a good practice even for history taking stations, you offer a chaperone for the patient. Make sure that you ensure privacy of the patient. You can verbalize this by saying that I'm going to take the patient to a room, or I'm going to take the patient into a cubicle. Offer analgesia, see if the patient is in pain, and make sure that the patient is not uncomfortable because of the pain. Next, briefly summarize the instructions that you've been given. For example, if it's a history taking station, tell the patient that I'm going to ask a few more questions. Are you okay with it? Or if it's an examination station, just briefly explain, I'm going to do this, 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 this. Are you okay with it? And whenever you explain this, also add a line saying that at any point, if you feel uncomfortable, just tell me, don't hesitate to tell me to stop. and I'll stop at that point, right? Whenever you begin, always, if you're asking a question, always start with open-ended questions. You may have to ask specific questions or closed questions to elicit specific answers, yes or no questions. But in the beginning, always start with open-ended questions. And as much as possible, whenever you're explaining something to the patient, avoid medical jargon. Even if you have to use medical jargon at some point for whatever reason, explain what that is immediately after you use the jargon. And it's always a good practice, and it also feels, and also it gives an impression that you're empathetic and understands the concerns of the patient. Always ask once in the beginning and once in the end, do you have any specific questions or concerns? Another reason why you would ask this is sometimes there is usually a hidden agenda in some of the stations. So for example, the patient may present with something, for example, chest pain. You ask everything, but unless you ask this specific question, do you have any specific questions or concerns? The patient will not tell that he's worried about cancer. So only if you ask this, the patient will tell that he's worried about cancer, and then he may have few more questions for which you may have some more marks allotted, right? Unless you ask this question, the patient may not volunteer the information. So always once or twice ask, do you have any specific questions or concerns? Once you finish this, once you complete your task, summarize your findings and tell the patient what's going to happen next. So your plan should usually include the investigations that you want to do and what happens once you do these investigations. What if this is positive? What if this is negative? What's your treatment plan? And do you need to admit the patient, or are you going to discharge the patient? And how are you going to follow up the patient? Do the patient need any specialty follow-up? Or are you going to refer the patient back to the GP? Or are you going to bring the patient back to the emergency department in a few days? Depends on what the condition is. And again, ask if the patient has any specific questions. So this is a general template for most of the stations, right? So if you get this perfectly right, even if you do not do the station very well, you'll still get a lot of marks just by doing these things right. So some of the other things that you need to remember for every station is that, again, I know I'm repeating this, but be very, very systematic. Be real in the sense, so imagine that you're working in a real life scenario in your real emergency department, and then go with the flow. So usually you will do well if you do that. But at the same time, there is a slight caveat to that. That is, so when you're in your real life, so for example, if you're doing an inspection, you wouldn't really be saying out loud that, oh, I'm not able to see any pallor, I'm not seeing any cyanosis, I'm not seeing any clubbing. You wouldn't really saying it out loud. But in the OSCE, unless you say that out very loud, there is no way the examiner can read your mind. So he'll not know what you're doing. So always in the OSCE, make sure that you verbalize something that the examiner knows what you're doing. Be very empathetic in all stations. Now, what does be safe mean? Whenever you finish MRCEM exams, you're expected to work at registrar level. So at this level, you make independent decisions. What does that also mean is that you're taking a significant amount of risk on yourself. So are you able to risk stratify and make sure that the patient is safe is the question. So how do they check that? So usually, are you able to look for the red flag signs and symptoms, and are you able to pick them up? Are you able to spot a critically unwell child or a critically unwell patient? And are you able to pick up all the life-threatening diagnoses and rule out one after the other? So by evaluating all these, the examiner is also looking, are you a safe doctor? And once you do all this, are you able to make a reasonable, safe plan for the management of the patient? Next thing is EM approach. Whenever you see a patient, whenever you formulate a plan, think about all the life-threatening diagnoses first and make sure that you rule them out one after the other, and also think about the common things. And always, whenever the patient asks you any question, address those concerns appropriately. And again, do not use any jargon. Another important thing when you formulate a plan is that not just thinking about the patient and the diagnosis, but also thinking about the patient overall. In the sense, you think about how does the patient cope at home. For example, if it's an old patient, and imagine you put a collar on the patient or a sling on the patient, and if you send them home, will they be able to manage by themselves at home? So you need to think about the family, social history, if there is somebody else at home who is usually being taken care by the patient, are they able to cope on their own? Do we need to arrange for any social services support? So you need to think about other things apart from just the diagnosis and the plan or the treatment as well. So always remember this whenever you make a plan. So another important questions a lot of people get whenever they practice stations is that, so the station is for 8 minutes. You start doing your station, and in about 6.5 minutes, you completely finish asking all the questions, you make a plan, and you're completely done, right? Then there is an awkward gap there where examiner doesn't say anything, you don't say anything, patient doesn't say anything, you keep staring at each other. So now the question is, can you ask more questions at this point? The answer is yes. So at this point, if you remember, okay, I haven't asked this question, can I ask it now? Yes, you can. So just say to the patient that, okay, apologies. So I think I forgot to ask this question. Can I also ask you this? Or if you've forgotten to examine something, you can go back and examine that as well. And then you can summarize again to the examiner. So that's absolutely acceptable. I think we have covered most of the general things for dealing with all kinds of OSCEs. On our next video, we'll talk about history-taking stations, and we'll talk in detail about different types of history-taking stations as well. Until then, goodbye.